Good afternoon, everyone, or good morning, depending on where you're joining us from. And welcome to today's webinar, FSMA and FSVP, Hindsight is 2020. My name's Amy, and I'm a member of the marketing team at Perry Johnson Registrars Food Safety, Inc. I'll be facilitating today's webinar and offering technical support to our speakers. Today, we're very excited to be welcoming back a familiar face, or voice rather, Jen Crandall of Safe Food en Route for today's presentation, and I'll be introducing her to you a little later on in the broadcast. Before we get started, I want to go over a few housekeeping notes. To ensure audio quality, all attendees are on mute. However, we do absolutely want to take any questions you might have. So to ask a question, you can just go ahead and type it into the questions tab of the GoToWebinar control panel and click send. We'll answer as many of these as we have time for at the end of the prepared slides. So please don't hesitate. Anytime during the broadcast, you don't have to wait until the end to go ahead and send those questions in. Some of the most frequent questions we get are, where can I get the slides for the presentation, or will there be a recording made available? And the answer to both those questions is yes, we will have the slides available from pjfsi.com, and the recording will be posted to our YouTube channel for you to review or share with anyone who couldn't attend the broadcast live. So just really quickly, this is what it'll look like on your screen. If you go ahead and open up that questions tab, you can type your question in and click send, as I said, and we will answer as many as we can at the end of the slides. Before I hand you over to our first speaker, though, I do have a quick polling question for you all, just to get to know the audience. And that question is your organization currently certified to a GFSI standard? Choose whichever of the options on your screen is most relevant to you. All voting is anonymous, so feel free to answer however you wish. We'll just get some participation here, and then we'll get right along and introduce our first speaker. All right, we are getting some great participation numbers there. Thank you all so much for voting. This is how things all shook out. So it looks like a majority of folks on the call today are certified. All right, I'm going to go ahead now and introduce our first speaker today, and that is Paul Demarin. He is the Senior Vice President of Food Safety and Supply Chain here at PJFSI. Paul joined us about a year ago and has over 35 years of experience in the hospitality, service, and retail agri-food sectors. Paul is a board member of the OFPA, that's the Ontario Food Protection Association, as well as an advisory council member with the George Washington University School of Business for their digital marketing certificate program. Prior to joining PJFSI, Paul worked for 16 years in the certification industry with clients in every sector from food safety and supply chain to brand protection and quality. Paul also worked for many years in management systems certification as well. And before that, Paul was a professional chef and consultant for over 20 years. So without any further ado, Paul, you can go ahead and take it away when you're ready.
Thank you very much, Amy. I appreciate that. Hello, everyone. Welcome to our webinar today. I'm very excited to have everybody here and join us, and we really appreciate your time. Of course, we're very happy to be back into the full swing of our webinar schedule now, having 2 a week. Over the next 5 months, it's going to be pretty packed and exciting. We have a lot of wonderful speakers. So we have a lot to unpack today, so let's just jump right in. As Amy mentioned, we're very happy to have Jen back here from Safe Food en Route. I've known Jen for well over a couple of years now, and every single time we have a webinar with Jen, we have great response and feedback. So thank you, Jen, as well for joining. So let's move right in here now to a little bit of an overview about PJR FSI. We were founded back in 1994. Sorry, I think I'm messing up the screen here a little bit. Let me just go back one slide. Okay, so I don't know what's going on here, but so sorry about that. So we were founded in 1994 as a management system certification body. They have been, expanding ever since then overseas, all across the globe. We are in Germany, Portugal, Spain, Canada, Latin America, Thailand. We've really been at the forefront of the certification industry from the very beginning. We have achieved multiple accreditations during our 30+ year time in existence, everything from ANAB to UCAS. We have several divisions of our company. Perry Johnson Registrars manages and works with companies across management system certification like ISO 9001 for quality or environmental, automotive, medical device, aerospace, you name it. We have PJLA, which is our laboratory accreditation business, and that was founded in 1999. We have PJNA, which was founded in 2005 as a healthcare technology company that specializes in telemedicine, transcription services, medical coding, etc. And then in 2012 is when PJRFSI was born, due to the requirements and demand in the industry for third-party certification. We're a global organization headquartered out of Troy, Michigan, and we certainly cover off many different standards and schemes that I'll talk to here in a minute. We have about, I think, 450 assessors, give or take, in about 60 countries around the world. And we work with really all types of organizations in virtually every sector in the industry. Let's just see if my, here we go. So retailers, processors, I'm having issues here today, everyone. I apologize for this with the screen. So really, we work with all areas of the food business, retailers, processors, farms, importers, and exporters. We're really committed to adding, value-added services for our clients and working to uphold the highest level of standards in our professionalism and technical competence. We have an outstanding client attrition rate. It's extremely low, only at about 1.7% over the last 3 years. And we continue to receive very high customer service ratings from our clients as well. So moving along to our services, we essentially have certification services that are divided out into 4 key areas. We have auditing and certification to third-party standards, like all of the GFSI standards or the family of ISO standards. We do second-party auditing, which is auditing that we as a certification body have written and developed the standard. So we own the content, the scheme. We have the technical staff who have written and developed these programs. These would be like our GMP for good manufacturing practices or GDP HACCP. The companies that use us for second-party services generally don't have the technical knowledge on site to be able to write and develop these programs. So they're looking for an out-of-the-box sort of plug-and-play standard that they can utilize generally for their supply chain or their sites if they're looking at a second-party audit as a stepping stone to a GFSI audit. We also do a lot of work with respect to first-party standards. So this would be where our customer would own and develop their own auditing checklist. Could be social accountability, food safety, brand protection. We do many, many different standards. And that's where they would engage us to go out and conduct assessments of their supply chain to help manage and mitigate the risk within their business. So moving on, this is just a snapshot of some of the 30+ programs that we support today in the food group. There's many different types of audits, as you can see. Some are accredited, unaccredited, some are client specific, some are government mandated, some are retailer mandated. And as I mentioned earlier, we do work across all sectors within the industry. We're also recognized by the various government groups to perform audits and inspections, such as FSMA for Food Safety Modernization Act, the FSVP audits, and also VQIP, which is the Voluntary Qualified Importer Program. So we do have, quite a large number of standards that we support. We are also recognized and have long-standing relationships with many accreditation bodies and scheme owners around the world. And accreditation really helps to give our customers assurance that the family of companies that we operate, and we do so under the rules of the accreditation bodies and the scheme owners, which helps to regulate us as a CB and maintain a high quality of work and expectations for you. It's certainly a large investment that's made every year by not only our company, but any certification body. But in the end of it, the end of the day, it's well worth it because it gives you confidence that you're partnered with a respected and trusted certification body. So just to wrap up my portion here today, I wanted to thank everybody again for their time. We have a lot to cover off here. I do hope that it's not going to be too much longer before we can start to see everybody in person again. But with that, I apologize for the touchy mouse today, but thank you so much for your time. And Amy, I'll pass it back to you.
Perfect. Thanks so much, Paul. Now, before I introduce our guest speaker today, I do another polling question. And that one is, what are the minimum requirements you have on your suppliers for food safety? Once again, all responses are anonymous, so just choose whichever response suits you and your business best. So I'll allow some time for participation. To anyone who maybe missed the introduction of the presentation, welcome. Thank you for taking the time to join us today. If you did miss the beginning and you wanted to see what you missed, the recording of today's webinar will be available on our YouTube channel, and the slides will also be available for download from pgrfsi.com. So go ahead and check those out. All right, we're right around 60% participation. Let's see a couple more votes in there from our attendees today, if possible. And then we'll move right along into introducing, Jen Crandall. All right, thank you all so much for your participation there. And it looks like the wide majority of folks use a third-party food safety audit. All right, without further ado, I'm going to go ahead and introduce you to Jennifer Crandall, the CEO and founder of Safe Food en Route. Jennifer has a food science degree from Purdue University and has 8 years of manufacturing experience with 12 years at Kroger's corporate offices. In 2018, she founded Safe Food en Route and is a U.S. country partner with Priority Limited. Jennifer and her team are in the food safety consulting space with focus on the FSMA Rules, FSVP, and supplier compliance management. And in today's presentation, Jen will be sharing with you some key tips for FSMA and FSVP. So Jen, thank you again so much for taking the time to present for us today. And I will go ahead and give you the reins.
All right. I think I have the mouse. So again, thank you to Amy and Paul for your kind introductions. My name is Jennifer Crandall. As Amy mentioned, I am the CEO and founder of Safe Food en Route. We developed and designed around making corporate level food safety programs accessible to small and medium-sized businesses. So a lot of the background that I had with Kroger that she mentioned, though I do not speak on behalf of Kroger, and I'll make that disclaimer up front right now, though I have that background, what it has done is help me enhance programs and help companies to design their programs around what a corporate level program would look like. So that's the mindset that I come from as I present a lot of this to you. So let us jump in. I do not see that I have mouse control yet. Is it going? There we go. All right, sorry about that. Maybe I'm not the only one, Paul's not the only one having concerns here. So today we're going to cover a little bit of legislative history. I have presented in the past with Perry Johnson Registrars, and we have talked a little bit about the FSMA and deep dive into it, but I think it's really important that we cover that history. We'll also talk about FSVP, some common mistakes that we saw in 2020, some of the lessons we learned in 2020 on the inspections, and some of the outlook that we're already starting to see unfold with 2021. All right, there we go. All right, so some of the history that we have hit, why did this need to, the Food Safety Modernization Act, or we like to call it FSMA, unfold in, from the legislative side of it? And we can easily see these types of headlines popping out: salmonella recall due to listeria, employees speak, and employees outbreak. Sorry, there's a typo on there for the hepatitis A outbreak that we saw. I think that was in early 2020 or 2019 now. It's been quite a bit of time. And then undeclared peanuts. Whenever I wrote this presentation, there was a recall going on around baby spinach related to salmonella, and there was one that was as recent. And I wrote this at the end of 2020. There was an organic basil outbreak that was also going on. So we know that there's a lot of reason from it. Also, we know that the CDC has said that 1 in 6 people get sick in the United States from foodborne related illnesses, and about 3,000 people die a year from it. So bottom line, we know we need it for public health. There is no reason that anyone should get sick just from sitting down and having a meal. That is when it's completely preventative. So when I was learning a lot about those regulations, from FSVP point of view and FSMA point of view, I found a lot of comparison between the old law it was more reactive, more record review, more complaint driven. In the new laws, what we have found is that it's more proactive. It's focused on preventive programs. I did not touch that, so apologies. Hold on, there we go. All right, so preventive programs and record review, it's a lot more risk driven. And the FDA did have the same type of authority. They did not have the same type of authority previously that they do now. They could suggest recalls, and there was a little bit of pressure around them, but now they can absolutely require recalls, and there's more jurisdiction now and more consequences to not meeting FDA requirements. And specifically in FSVP, that can be criminal penalties, and that can also be fines. So there's a lot more incentive for companies to follow this rule than there had been in the past for some of these types of just having these policies in place. All right. Okay, so some of the high level requirements, sorry, this mouse is I don't think it was Paul's mouse. It's definitely something going on with the connection here. So all entities, foreign and domestic, manufacturers, processors, packers, and holders of food are covered under the new FSMA regulations. Everyone must analyze if there is a reasonably foreseeable hazard required, and that if it requires a preventive control. And also, if the hazard exists, that ensure that preventive controls are implemented and they exist in general. So like from the importer perspective, which is the kind of the space that I play in the most, the goal is to make sure that any hazards that do exist, that have been identified associated with that food are controlled or are told to the consumer how they can control it. What I like to bring in, and I talk a little bit, in between conversations with people, one of the things we used to say a lot at Kroger was know your suppliers and know your products. So I'll touch on that in a little bit. I just wanted to bring that up, that this is one of those laws that are written around know your suppliers, know who you are working with. All right, so the FDA side of things, there are 9 rules currently with FSMA. So the associated rules follow as these: the current good manufacturing practices. There's a very lengthy name for these rules, and then there's what's in bold print that we call it on our site. So I'm going to only read the bold print, but you can see how lengthy the name of this is. So this is the preventive controls for human food rule. There is a rule for animals, for foods for animals. There's a rule for produce, which we a lot of times call produce safety rule. There's mitigation strategies to protect food against intentional adulteration. We call it intentional adulteration. The sanitary transportation rule, and then my favorite that I mentioned, the foreign supplier verification program rule, or we like to call it FSVP. And there are 3 other rules that I knew I hit it accidentally, so I might go another slide. I apologize. It's a little delayed on how it interacts with us. So there's also the accredited third-party certification, the voluntary qualified importer program, BQIP, as we call it, the FSMA proposed rule on laboratory accreditation, and currently there is also, which I should have written, it's a proposed rule as of today. I think the comments have stopped on the traceability rule, so that one is also out for comment, but it may be final. Today might have been the final day for those comments, and so those are some of the other rules. Those are either voluntary. These 4 that are listed here are either voluntary or they're still being implemented. So the other rules that I mentioned prior are required for the industry, but these are the ones that are either voluntary or still in, rolling out. So we're still learning a little bit about it from the guidance documents that might be in place. So let me click here. Also, the industry is also watching and participating in the development of the new era of smarter food safety as the FDA unfolds their plans to help us get more in line with technology as an industry. And this is really something that a lot of people are paying attention to. You might hear people talk about blockchain, and we'll touch on that a little bit with just discussing in general how to automate a system. And I believe I have some plans with the Perry Johnson Registrars team to discuss in the future some about the traceability rule, and also to discuss a little bit about how to automate your program. So I'll touch on that just a bit in a few slides. Also, so let's go on to this one. So from the Smarter Food, oh my goodness, I promise you I didn't touch everything. So from the Smarter Food Safety Blueprint, these are the 4 elements that they're looking at. They call them the 4 pillars that are being discussed in the blueprint straight off the website. I pulled these right off of that. And Safe Food and Root at our organization, we are monitoring and staying in tune with this, as is Perry Johnson Registrars, and as several other entities as well. They're looking at tech-enabled traceability programs, smarter tools and approaches for prevention and outbreak response, new business models and retail modernization. And this one, which I'm seeing some really cool traction in food safety culture. There's a lot of discussion around food safety culture right now. And we're really interested as an industry how that one plays out as well, because that can be measured in so many different ways. So let's jump into the current good manufacturing practices. This is probably for the majority of the audience if you're already certified, which I know a majority of you said you were already certified, so you already know these. You probably have them very well implemented into your programs and policies. But the current good manufacturing practices touch on personnel, plant and grounds, sanitary operations, sanitary facilities and controls, equipments and utensils, and so on. I don't have to read the whole slide to you. The intent of this, what we have found is that the common elements in the FSMA rule require entities to follow and or ensure things associated with GMPs and with good food safety policies. And this is the core to all of the rules and built into the requirements. So many of you on this webinar, like I said, are probably familiar with these practices, and most have implemented them in your facilities and or supply chains. From the preventive controls, I'm assuming if many of you are manufacturers that you also have these implemented as well if you are under FDA jurisdiction. But a food safety plan includes a hazard analysis, preventive controls, parameters and values, which I always like to say this is a lot like HACCP, and those that are familiar with HACCP. So a lot of these have some similarities to what the requirements are for a certified HACCP facility. So monitoring, corrective actions, verification, record keeping, and a recall plan. One thing that I do share on this slide often, that when I was going through preventive controls training, I was learning, I learned about a good example, and I think I shared this the last time. Preventive controls and HACCP have kind of a critical control point that they identify, but in HACCP, they focus very much on the last step where you control the hazard. Where in preventive controls, it's a risk-based approach to controlling the hazard every step of the way. And even though they're very similar principles on almost all of the different types of things that are included in the food safety plan, the whole intention with preventive controls is that we're monitoring it every step of the way. Some of the history that we've experienced with HACCP, at least whenever I was in college, which has been forever ago, but my food micro teacher taught us to limit how many critical control points that we mentioned in our HACCP plan, because that meant that we had to design a lot of programs to do control the hazard, to be able to have critical limits and critical monitoring around it, the corrective actions. And the idea was the less that you have, the less you have to document and control. Not that we didn't have that intention to document and control and manage it all, but it was just like a very formalized approach to managing everything. And I think that this is just the opinion of Jennifer Crandall, nothing else. Don't take this as legal or law, but from our perspective, the preventive controls rule really makes you look at every step, every hazard, and determine, is there a hazard here? Does there need to be a preventive control? Do we need to be measuring it? So thinking about these things for, all the other rules. So produce safety rule, though you don't have to have a food safety plan in place for most of the produce industry that is doing fresh produce and some of the raw agriculture. They still have 5 elements that they need to have proof of support built around them in the form of policies, procedures, testing, training, and that type of program. So and these are the 5 elements, the agriculture water management, which there are still things being defined by the FDA, whether that ag water management, what is like the frequency of testing that we need to do, what's the type of testing that we need to do for specific types of the vegetables. And honestly, I've been staying a little out of touch with that, so I'm not sure the movement that's going on with the FDA on that side of it. Let me click back. Apologies again. I moved my hand, so I think that sometimes it's moving whenever my hand is moving, or I'm fighting with somebody else in the webinar. Here we go. All right, hopefully it'll stay. Okay, so then they have programs around domesticated and wild animals. Then they have soil management, which really is manure management for those of us that are not in the industry. Biological soil amendment is the manure side of the business. Health and hygiene of the workers, and then of course the equipment, tools, building, and sanitation, which is where a lot of those GMPs might live in that process as well. Okay, so let's go on to that next slide. So this is my favorite rule, and I didn't realize I didn't put a header on it. So this is the FSVP rule and the requirements around it. We have the hazard analysis. So you're going to see some similarities with the FSVP and the preventive controls rule. So you have the hazard analysis, you have the evaluation of the supplier. So this is a supplier evaluation. You need to maintain an approved supplier list. You need to establish a written FSVP plan, which I will say for the written FSVP plan, when I've gone through inspections with some of my clients, and what I'm finding is that the FDA is looking for an SOP here. So for those that are not familiar with what's required with an FSVP plan, you need to have an SOP. They are asking you for it. So I'll talk about that in a few minutes as well. And then you need to verify that the supplier is managing the hazards that you identified with the products that you are importing, that you have corrective actions for it when they're not. You have a reevaluation process written into your SOP, that you have somebody being identified as FSVP importer at entry, and then there are specific requirements around the record keeping for FSVP and who is required to, how long you're allowed to keep the documents and how often you need to do a re-verification of that supplier. And here I highlighted for you so you could see it. These are some of the same elements that are in the preventive controls rule. So the hazard analysis, the supplier evaluation is something that you do often in the preventive controls rule. The verifying, corrective actions, reevaluation, record keeping. So you're seeing some similarities between the two rules. The idea, and again, opinion of Jennifer Crandall, not legal advice. I don't want to portray this as legal advice, but from a corporate level food safety program, what I see is that the FDA is trying to help you define a good supplier compliance management program with the FSVP. That's basically what it is. So that's why you see some similarities in the preventive controls plan and what you need to do for the, for human consumption and for food for animals, you see some similarities in it, because part of those elements are doing a product analysis, doing a raw material analysis, and then how are you applying the kill step in your facility. With importing, if you're not applying the kill step, how is the foreign supplier applying that kill step? Are they doing what is required by US government? Are they doing what is required to control that hazard? So that, to me, that's what the FSVP kind of breaks into. So let's jump into, I believe it's going to probably hand this off. Well, one, let me just say this, because this is one of my favorite quotes. I actually start my day almost every day now with this quote: quality is never an accident. And you can sub food safety for quality, okay? So just think about any word that goes into that quality statement. Some of you might have seen this quote before. So quality is never an accident. It is always the result of high intention, sincere effort, intelligent direction, and skillful execution. It represents the wise choice of many alternatives. And I do like this quote as well: quality is everyone's responsibility. So it's everyone in the chain that is required to manage this, which I think as the traceability rule starts to unfold, people will start to see their position in the supply chain as well, and their responsibility and liability, and how it falls. So let's jump into this slide. I'm sorry, I thought I was coming up on a poll, but it's in a few minutes, so we'll come back to that. So one of the things that, just looking at that slide prior, the quality is based on intentional design. Safe Food and Root, one of the things that we strive on is that we like to have thoughtful designs with our process. And this is not meant to be a sales pitch by any means, but what you can see, the difference that I see in larger companies versus smaller companies is the number of hats dedicated to a small handful of people versus spread out over the departments. Larger companies have lengthy process to approve products before taking them to market. Many have a subject matter expert for categories of food, depending on the product offerings in that company. And what I see is that the smaller companies and the medium-sized companies might not have that same bandwidth. And so what we do, often in growing areas, supplier risk and QA management programs are an afterthought or something that companies just can't afford. So that's one of the areas that Safe Food and Root comes in to help our clients manage that, so that they can focus on, some of the other elements that are required related to, running your business and doing product development innovation. So the other piece of this, product approval process, and the good news, like I mentioned with FSVP, is that it has a great structure to follow when it comes to managing supplier and product compliance. Just looking at the products and the hazards that are associated with them, reviewing supplier performance overall, and the regulatory history and any other known issues, and then reviewing and verifying that the supplier is meeting those, managing those hazards appropriately. The bad news, or opportunity, as some might say, is that this is often where the small and medium-sized companies need help, is in that verification bucket, just knowing what hazards to look for and knowing if they're being managed well enough. If you don't have somebody in that food safety space, then it might be, you might not know that the supplier is actually managing the hazards appropriately. So what a product hazard analysis looks like, whenever you go through that, you have many steps to include. What the FDA is looking for when an appropriate product hazard analysis is complete is identifying the hazards associated with the product. This includes reviewing the physical, chemical, allergenic, microbial, and/or radiological hazards, and determining the likelihood and what happens if the hazard is not controlled. What is the risk? Will someone get sick? Will they die? When you look at the combination of the likelihood and the risk, if it is not controlled, you can determine if the hazard needs control. So that's, moving on to the supplier and review and determining, are they managing the risk appropriately or not? So kind of looking at supplier performance, what's their regulatory history? Have they ever had a recall or an action against them, such as an import alert, an import refusal, regulatory citation? What is their history as a supplier to you, if applicable, that you might not know because you might not have ever had them as a supplier. But if you had, you might have some answers to that. Have you ever had a problem with them in the past? Do you track that and rate it? Has there ever been any food safety incidents? Have they had any complaints? And then if this relationship is new, then you can look at, you can ask for referrals. And you can check with them on their performance with those same questions. Audit history might include reviewing their third-party food safety audits. If they have had an audit in the past 12 months, you should review them. Are they certified with one of the GFSI benchmark audit schemes? Have they been audited by a regulatory agency? Have they been audited by a customer that is willing to share those results? So sometimes some of the customers might be okay with you sharing the results of their first party audit that they might be doing. And if you haven't audited them yourself, is that a potential option? Could you send your food safety team to them? Second party audits can reveal a lot from the food safety perspective, as well as give you a lot of confidence in other areas of the capabilities of that supplier. So it's always good to visit your supply chain, and it helps you build your relationship more in depth and build some of that loyalty. So that's some of that food safety culture I mentioned before that might be built in, like that's how you build supplier relationships. So it's good to set standards for supplier programs, and I know a lot of you mentioned, I think it was about 74% that at the time that we put the poll up had the minimum requirements of third-party food safety audits and GFSI benchmark audit schemes potentially for their suppliers. So it's good to set those. Many large retailers, if you are not a current supplier to the retailers, many of the larger ones and the larger wholesalers use GFSI benchmark audits as their requirement for supplier programs to ensure they are managing their programs appropriately. Other options, like I mentioned, I did mention customer audits, I mentioned third party or GMP audits, or doing regulatory review. Another consideration is that just like the products you're purchasing, you need to make sure that your suppliers are reviewing their programs as well. So like going that one step back, but you're really going 2 steps back just to make sure that they understand who their supply chain is, and that they understand who their customers are, and that they're paying attention to the hazards both on the incoming and the outgoing. And now with COVID-19, that's just another space that we have to start kind of paying attention to with, if you haven't already, just understanding what your supply chain is doing to manage COVID-19 in their facilities, because we are at a new point where the health and hygiene of the employees is, and the visitors that are going into it, are just as important as the food safety programs. Again, that food safety culture piece. This is part of the soft skills. How do you manage your employee health and wellness? That is just as important as making sure that you have well-written food safety programs. Okay, so now I believe we're at that polling question that I thought about.
Yes, it's finally time. We do have another polling question here. And that question is, what type of supply chain management program do you have in place? As before, go ahead and just choose whichever option suits you and matches, your business the best. All responses are anonymous during the webinar, so no worries there. And for anyone who might have joined us late, if you wanted to catch up on what you missed, the slides will be available from pdrafsi.com, and the recording of the webinar with the voiceover and with all of the crazy mouse antics will be available from our YouTube channel. It's not a problem, Jen. Honestly, I think it's just the slight delay makes it seem like it's not responding, and then it jumps ahead 3 slides, and then you have to go back. No worries there. We're all with you. All right, we'll wait a few more seconds for a couple more votes to come in, and then we'll see how the responses shook out. All right, fantastic. Thank you all for your participation. That's how everyone voted out. And it looks like a lot of folks use paper forms to collect data from suppliers.
Yeah.
All right, and I'll send it right back over to you.
Okay.
Take it away.
All right. Let's talk about some automation. So where can you automate all of this? That is the big question. There's lots of places to automate, and the reason I put that question in there is just to understand the audience better, because supplier management, FSVP, preventive controls, all of that. And when you say that 72% of you are collecting paper files now, granted, I think the way the question is worded, there might not be an option in there for some of you. And I had that feedback before on how you're managing your files. But if there is, please put in your comments, tell me what option I might have missed if you were trying to say that there's a different option in your automation or in how you manage your supplier files. But what I want you to do is focus on, what processes, what documents make sense to manage that you use, and what makes sense to manage online. Using a software to help you with this is key when you have mass volume of documents to manage. Also, what processes can you streamline? So again, the FDA blueprint that I mentioned before for the new smart or food safety era, the FDA is encouraging that you take automation into consideration. The traceability rule is very much written around the idea that you digitalize and automate your processes. So they are highly encouraging you to take that step. So you have some regulatory justification, quote unquote, whenever sometimes we're looking for, justification, but you also have tremendous return on investment whenever you look at these types of processes. So where can you streamline it? If you have a lot of suppliers and products or raw materials, does it make sense to automate some of the processes to assist you with managing the programs? If an automated workflow is something that you need triggered by expiration dates or automated reminders, et cetera, those are things to think about. There's all kinds of considerations for automation and how you might want to manage it. And I just put up a few here to consider as you, go through some of those decisions that might help you make a choice to go towards automation. I personally could not handle the type of volume that would come in with supplier data and product data without that automation tool. And all of Safe Food and Root processes are built around automation because of that. Because when I was at Kroger, again, not speaking on behalf of the Kroger company, but just my corporate experience and what I have witnessed, to manage this all by spreadsheet and by paper documents, you're going to lose control of it really quickly. So, I just look at it like, could there be workflows built around receiving information administratively and then having an expert spend the time reviewing the file instead of chasing the files? That's your return on investment of looking into possibly automating. So I don't want to spend too much time on automation because that's obviously not why you're here. A lot of you want to know what are common mistakes and lessons of FSVP from 2019 to 2020 inspections. So one of the things that we saw come up over and over again, and this is not just 2019, but I saw this in 2018 as well, not creating a written plan. That was the most common citation on the FDA website. And that was actually 2019 data. That was the most common thing that was found in 2019. Not considering other laws applicable and adjusting the hazard analysis to it. And one of the things that we're seeing pop up now is not validating that the law applicable. So, like for example, if the company needs to do low acid canned food, type process, and they qualify for that and have that validation step, that the importer has to validate that they are approved and registered for that process. So that's something that's starting to get noticed, and we're seeing some warning letters go out about that. In the early days, it was assuming the size meant exemption. Now pretty much everybody is required, but there's still some rules in there about who has exemption and who doesn't. This one, to me, this one is one of the biggest concerns that I see, and why I started Safe Food en Route was assuming the customer is the FSVP importer on the records. The conversations that I was having towards the tail end of my career at Kroger with companies were that, you know, the retailers and the wholesalers took a stance that in the event that a U.S. customer or a U.S. consignee could take on the role of FSVP importer, that the customer didn't want to take on that responsibility. And because of their bargaining power, because of how large they are, they could push that responsibility onto the consignee, which meant that distributors and you know, importers were put in the position that they were to take on this responsibility. Well, through the conversations that I was having, many were displaying that they didn't have the technical knowledge. To go back to that slide that I had with, you know, the product approval process and the many hats that several of these companies were wearing, and the people that I was interacting with at Kroger. Again, not speaking on Kroger, speaking on my, you know, my experience from the position I was in. The people that I was speaking to, a lot of them did not have a food safety expert helping them. So they may or may not have been doing what was necessary. And when you take on that responsibility of FSVP importer on the records, you take on the liability of doing the work that's related to FSVP. So you have a program. If you're saying your customer is doing that and your customer is not aware of that, then you're putting them at liability. But if they have this contract with you saying, we're not going to act as FSVP importer, then the FDA is going to just chase you right back and say, well, you know, you signed a document with the retailer saying that you're taking on the responsibility. So that was a big one that I saw. And that kind of leads into not using a qualified PCQI trained individual to conduct the risk assessment. So some of the hazard analysis, some of the supplier evaluation, that all of those parts can be outsourced. You can have other people do it. You can do it internally, but not having someone trained on understanding the hazard and assessing whether the risk assessment is actually done is a mistake that I see regularly. You have to have somebody that's food safety trained and understands the risks and how to manage them to be able to tell you, yes, they're meeting US law requirements, or no, they're not. You can't just check a box and say, oh, they meet this, you know, third-party food safety audit requirement, or they have no regulatory implications. It definitely could mean that they have, you know, there might be risk there that you're not aware of, that you need to have somebody trained to tell you. Assuming suppliers are in good standing with their home countries, this was something that, you know, as you import in products, you may see no record in the on the US side, but it's good to try to dive into to see if there's any records, regulatory, you know, any concerns from a regulatory side of it in the home country as well. And then not monitoring and or corrective actions when incidents do occur. So I think we're going to start seeing this one pop up a little bit more in 2021, is some of that not monitoring or conducting stuff. So conducting corrective actions. Okay, so so moving into the main thing that we saw from 2020 inspections, or that this is kind of what I expect in 2021, but it's what I noticed the trend in 2020. They increased the number of inspections. Post-COVID, they became online via email. So you receive an email from the FDA, and you can tell that's the beginning of the inspection process. They start asking questions about your importing, and they usually ask about a specific problem or a specific product. The educational campaign that they were doing, so the first couple of years was a lot of campaign of, we visit you, we look to see if you have a site. You may get cited, you may not, but it's not like a Form 483 warning letter. They did more of an education, like, hey, you need an FSVP, and they would open and close that citation immediately. Now they're doing enforcement. So Form 4083s are, Form 483As are being handed out. They are scrutinizing, they're starting to scrutinize identified hazards. And I experienced that in inspections that I partook in with my clients, where they're asking us, how did you identify the hazards? Where did you get the information? And the biggest thing that we need to kind of sit down and look at is that for 2020, the #1 FDA citation was the FSVP citation for FDA. So there were 514 citations that happened in 2020. It was the #1 citation. So they have definitely increased those inspections, and they're now definitely shifting from that education campaign towards enforcement because they're giving out citations pretty regularly, which also means that they've increased inspection. So we're already seeing several new, like from Food Safety News, it's one of the news sources that I follow. They share FSVP warnings that have happened already. There's been several already this year in 2021. So kind of what are we looking for the outlook in 2021 in general? You know, and again, this is just my disclaimer. It's a disclaimer. It's just my expectation. I don't really know what's going to happen other than what, you know, the trend looks like. So, you know, understand, I'm not saying this will happen. And with COVID, so many things have changed this year. So they might be shifting and I may not be aware of it, but I think you'll see that the FDA will continue more online inspections. Despite COVID, they're going to continue reaching out. I've already seen some clients come across my desk that have been. I think you're going to see the trend that I saw in 2020 is that 2018 had visits. So in 2020, if you were visited in 2018, they revisited in 2020 if you did not have a program in place. I'm already starting to see that unfold again. If you were visited in 2019 and you did not have a plan in place, or you had something that the FDA kind of educated you on, quote unquote, then you should expect a second visit soon because they're starting to come around again. We're going to continue to see that education shift to enforcement. And then there's going to be a closer review of risk assessments and verification. So kind of moving away from not just looking at the hazards, but actually diving into how the hazards are managed and how you're verifying them. And I think from that, you're going to see more Form 483A citations. So that's just my guess. You know, and I'll welcome questions. I know we're cutting it really close to time, to the top of the hour, so I'll move into letting Amy take over for the polling question, and then we can maybe answer a few questions and follow up with you after if we don't answer all of them.
Absolutely. Thank you, Jennifer, so much for, as I said before, presenting today. We do have one more quick polling question, and this is just to gauge what topics you all might want to see in future webinars. You can choose as many or as few of these as you wish, and we'll just take those into consideration when we develop future webinars on our schedule. Speaking of future webinars, we do have a very full calendar coming up. You can see all of those at pgrfsi.com/webinars. On Thursday this week, we do have Managing Risk During a Product Crisis, featuring Nishat Sufi of JIT Experts Hive, coming back for another webinar. Then we also have webinars, at least 1 or 2 per week, as Paul said at the beginning of the webinar, through June. So we hope you can join us for those webinars. They're all free to sign up. And as I said, we're very excited to welcome everybody. All right. So it looks like pretty diverse interests on those webinar topics. So we'll see what we've got in store for you. But we're going to go ahead right now into the question and answer portion of the webinar. So let me see what questions you all sent in. All right, let's see here. All right, we have a question here. We have 2 questions here actually from Daniel. So I'll ask the first one separately. Daniel asks, if my company has a parent company overseas and we purchase raw material from the parent company, do we need to add the parent company into our FSVP?
Oh, that's a good question. So from the FDA's rule, the way the FSMA or the FSVP rule is written, you can either have the U.S. customer, the U.S. consignee, or a U.S. agent, if those two do not exist, be FSVP importer. So depending on where the parent company is located and where your company, from the parent-child relationship, the child company, where it's located. If the child is established in the United States, then technically you have to have an FSVP written around the parent company policies if the parent company is not located in the United States and established here. So it's the quick answer is yes, you need to. The longer answer is you might be able to adjust the way you manage it. And if you want to take that offline, we can talk a little bit more about that. I'm happy to answer that a little bit more in depth.
Absolutely. Follow-up question from Daniel was, what products or suppliers are exempted from FSVP?
Oh, well, there's several, and there's a great resource online that I can share with with the audience. And I won't be able to share it right away. It's like a PDF, but they give you a way to see if it's exempt. But anything that's like juice HACCP, alcohol and beverage type items, seafood, there's some exemption around those. But there's a great questionnaire that the FDA has designed to help you kind of go through a decision tree of whether things are exempt or not. So rather than me quoting everything that's in that, I would say that's a better resource. So I'll make sure I provide that to Amy and the team so that they can share that forward with you.
All right, great. Let's see, there is a question from Bonita. Bonita is asking, are there any third-party audits approved by the FDA's certification bodies to audit FSVP, such as FSSC 22000, BRCGS, etc.?
Oh, Paul, I might tag you in because I don't know if I know this answer, and you might know it since you guys are a CV.
I'm not sure. I think Paul might have stepped away to deal with his technical issues over there. Paul, are you still with us? All right, it looks like Paul stepped away from his computer to try and solve his technical debacle there. But Bonita, I would absolutely encourage you, Bonita, to please email pgrfsi@pgrfsi.com with your answer, and that will be directed onto whoever can answer that question for you. As I personally, unfortunately, I'm just a lowly marketing individual, so I don't know the technical specifics of what qualifies by the FDA standards.
Yeah, and so that might also fall under the other rule of the third-party accreditation. So that's why I wanted to tag Paul in, because I'm sure he's familiar with who is approved and who isn't.
Absolutely. I will make a note here to forward the contact info for Bonita over to Paul so he can answer that question.
Okay.
All right, we do have a question here from Dylan regarding remote inspections. What do typical remote inspections look like? Is it all conducted through email?
Oh, so like, well, the way that was just mentioned, remote. So I think it depends. If you like, FDA does a lot of the conducting over email and through the phone. So if that's, I'm going to take it that that's what your intent is. How is the FDA doing remote inspections? What I've seen so far is you do a lot of communication initially on email. You might take it to a phone call if they need a little bit of explanation, and you're sharing documents back and forth. The way the rule is written, you need to be able to provide them with information within 24 hours of their request. Like a lot of times what I see is they'll ask basic questions about, are you the importer? Do you know this supplier? Do you know this product? Kind of questions first, just to make sure that they're talking to the right company, and then they start asking for more documents once they get answers to drive them to say, yes, you're the right person to talk to. Then they'll start asking for some of your documentation around your programs, and you can provide that digitally through email. And then once they do the inspection part, and it varies because you keep in mind that these are FDA inspectors that work with the customs agents that are conducting these audits. So they're very busy and focused on customs entry as well. So they're a lot of times are working around the ports and somewhere near them. So they might be juggling a lot, but they try to do most of the remote work is via email. And then if they have to pick up the phone and talk to you a little bit more, they will. Hopefully that answers.
Excellent. Yeah, I know we're right at the top of the hour. Let's squeeze in one or two more quick questions. We've got another one here from Bonita, and that is, can COAs from the supplier be used as a verification documentation?
Oh, yes. Yeah. So the FDA was very flexible about what a verification activity is. So they give you quite a bit of flexibility of how to write your program with, to verify. So you can choose to do certificates of analysis as one form of doing a verification activity, or you might do random lab tests where it's not necessarily a certificate of analysis, but maybe you have, like you random sample once you receive it here in the United States and send that off for sampling and lab tests as well. So there's many different ways that you can do it, but certificates of analysis is certainly one. I would not build and design your whole program around just that as your process, though. There needs to be a little bit more, designed with how to do the corrective actions, what types of tests are you doing, et cetera. So you can't rely on the supplier to define their certificates of analysis. You have to be very definitive what you want from them.
All right, excellent. And just one more point here. There were a couple of inquiries via question regarding what services Safe Food en Route offers regarding FSVP. What's the best way to get a hold of you? I think you have an email address on a previous slide, I think I can put up on the screen.
It might be on my last slide.
There it is.
Yep, you're more than welcome. Email me there.
Yes.
I'm happy to talk to anyone that was on this webinar. Please make sure that you let me know about the webinar that you attended it and where you found out about us. But yeah, reach out to me at that email. You can also go to our website and check out some of the services as well that we offer, but it might be easier to email me as well. So I welcome that. And if you have other questions that you didn't get answered today, let me know, and I'll be happily entertain them.
Yes, absolutely. And the same goes for PGRFSI as well. If you had any questions regarding certification options or training that we might be able to offer, please do reach out to us. Again, that email is pgrfsi@pgrfsi.com, or you can simply go to our website, and there is a contact us form that you can simply submit, and someone will get a hold of you, usually within the next, couple of hours of submitting it. So any parting words of wisdom, Jen? Any bigger predictions for 2021? Who's going to win the Super Bowl this year?
Yeah, no.
Anything's possible, right?
Well, let's see. Who won the Super Bowl? Wasn't it the Tampa Bay one, right?
Yeah, you're asking the wrong person. I'm not sports.
Yeah, me either. No, I no parting words other than, reach out to us if you have questions. FSVP is 100% Safe Food en Route, so wheelhouse. So we're happy to help you navigate that rule a little bit more. We have several team members that are available, and we have a very standardized way of managing it. So, tried and true process that I'm happy to share with you via conversations in the future.
All right, fantastic. Well, we hope to have you. Well, I know we're going to have you on for at least a couple more webinars this season. Hopefully, we will see some of our attendees today on those other webinars, and I'm going to wish everyone a safe and happy rest of their week. Stay safe and stay healthy out there, everybody. Have a great day.
Thank you so much. Thank you to Perry Johnson as well. I appreciate it.
All right, see y'all later. Bye.
Bye.